Hello, I'm Dr. Simon Moore.
Hi, and I'm Dr. Paul Dillon, and welcome to February CFP Distilled. So let's talk about the first article. We're going to talk about the top 3. So the first article is about cannabis use in pregnancy.
So
is it
Paul,
safe, Simon?
Have you ever used cannabis while being pregnant?
No.
Okay, well, if you are pregnant and using cannabis, or if you are breastfeeding and using cannabis, you'd think maybe it's a good idea because don't they use cannabis to treat nausea and vomiting and chemotherapy? And yet the answer is yes, they do. Guidelines do recommend using cannabis for chemotherapy. But in pregnancy, what's the bottom line? Not safe. Don't use it. Don't recommend cannabinoids in pregnancy or breastfeeding.
So you might have patients come into the emergency room or even into your clinic with a complication. They might actually be using cannabinoids or cannabis, and they can get such a tough word to say, isn't it?
Okay.
Cannabinoid hyperemesis syndrome.
Excellent.
I've seen this a number of times.
You've seen it, but you can't say it.
Exactly. Brilliant. So they'll come in, it'll be acute onset, nausea, vomiting. They might take hot showers, long hot showers to relieve the symptoms. In the emergency room, sometimes we use topical capsaicin cream, but bottom line comes back to removing that underlying cause. No cannabis use in pregnancy or while breastfeeding.
Number 2 article from the CFP Journal, February 2020, is about patients who come to our clinic and say, Doc, am I going to get skin cancer because I'm taking hydrochlorothiazide?
Absolutely not. But I have seen these patients come into my clinic because they've heard these stories from newspapers about this dangerous risk. They're going to get skin cancer because they're on hydrochlorothiazide. So what are you going to tell these patients? Number 1, you can consider changing the medication. 2020 hypertension guidelines, switch to a thiazide-like diuretic. Indapamide, chlorothalidone, those are my 2 go-tos. But what about that risk? So the baseline risk for squamous cell carcinoma, 0.01% per year. The longer they're on hydrochlorothiazide, the longer they're on a higher dose, increases their risk. So it's a balanced patient discussion, but tell them the baseline risk is low and there are other drug options.
Third article, it's about all the rage right now, intermittent fasting. So they did a meta-analysis. They looked at a couple dozen articles on intermittent fasting. And I like to think that I do intermittent fasting quite well. In fact, I don't eat for 8 hours every single night.
That's not how it works.
Oh,
I'm shocked. How do you even get 8 hours sleep a night with 2 kids in a busy clinical practice?
Yeah, you're right. I don't.
You're lying. So intermittent fasting is actually eating during an 8-hour window. So you're having all your meals during that 8 hours, and then you have 16 hours of fasting. Evidence still waiting on it. So close kind of short-term studies show some potential benefit, especially in those with type 2 diabetes, but longer-term studies, we're waiting out on them.
That's your summary of the February 2020 CFP Journal articles, Top Clinical Pearls. If you want these in your inbox, we email these out every month. You can sign up at cfpdistilled.com.
Until next month, I'm Dr. Paul Dillon.
I'm Dr. Simon Moore. Take care.